Hi everyone. Today we will be discussing medical instruments which are constantly being asked in Vivas and NEET PG. So today's instrument is Sengstaken Blakemore tube. Now, what is the purpose of this tube? How it is used? It is used to actually control the upper GI hemorrhage. Now see the image of this tube. It has three channels. One small balloon which is known as gastric balloon and one bigger balloon which is known as esophageal balloon. Now, what are these three channels? Esophageal balloon channel, gastric balloon channel, and gastric aspiration channel. So it has three channels. Now, what is the mechanism by which it helps us to stop the hemorrhage from the bleeding varices? Now, discussing the mechanism. Mechanism is after the insertion of the tube, you, you have to first inflate the gastric balloon, which with 300 ml of air. Then you have to pull this inflated balloon towards the bleeding varices. So, due to the tamponade effect, bleeding from the varices stops. But if after the inflation of the gastric balloon, bleeding does not stop, so what you will do? Now you have to inflate the esophageal balloon with 40 mm of Hg pressure and wait for the bleeding to stop. And again, the mechanism is same. For if the bleeding stop, it will stop due to the tamponade effect or the pressure effect of this inflated balloon. But there is one important thing to note here, that esophageal balloon should be deflated every 12 hours to prevent the necrosis of the esophagus. Now moving on to another tube, that is Linton's tube. Now what is the difference of the Linton's tube? How it is different actually from the this SB tube which we have discussed earlier. Now see this tube. It contain only one balloon. It has three channels, but it contain only three balloons. Remember this. Now this moving on to another tube. It is Minnesota tube. It is a modification of SB tube. Now we have discussed the SB tube above. Now what is the modification in this tube? What is the special thing? It has three channels of the SB tube. Remember the three channels. I have told you that SB tube has three channels: esophageal balloon, gastric balloon channel, gastric aspiration channel. It has all three of them, but there is one another channel, fourth channel, which is also present in this tube. What is this channel? It is known as esophageal aspiration channel. Now see the image like this. It has four channels, another channel which is esophageal aspiration channel, and two balloons which are similar to the SB tube. So during your vivas, remember all these three tubes will be lying on the table. Don't hurry to answer. First see the tube, see how many balloons are there. If single balloon, it is a Linton. If two balloons, then see the channels. If it has three channels, that is the SB tube. And if the tube has four channels, then it is a Minnesota tube. Remember this. Don't get confused and don't answer wrong in the viva. So lastly, if you have any question regarding this tube, you can post in the comment section, and don't forget to like, share and subscribe. Thank you.